Type 1 diabetes remains one of the most challenging chronic conditions because, despite decades of medical advancements, there is still no known cure. This autoimmune disease fundamentally differs from type 2 diabetes, which many people manage or even reverse with lifestyle changes like diet and exercise. But here's where it gets controversial. Type 1 diabetes cannot be reversed or prevented, since the body's immune system attacks and destroys the insulin-producing cells in the pancreas permanently. Although ongoing research is making promising strides toward future treatments, those living with type 1 diabetes currently rely on daily insulin injections or pumps and constant monitoring to stay healthy. It's important to know that type 1 diabetes can be diagnosed at any age, from childhood to adulthood. Diabetes itself is a long-lasting condition that affects how your body converts food into the energy you need. Normally, your cells use glucose, the sugar from food, as fuel. But in type 1 diabetes, the critical beta cells in the pancreas that produce insulin are destroyed by the immune system, for reasons scientists still haven't fully deciphered. To put the scale into perspective, the National Diabetes Statistics Report estimates that in 2021, around 38.4 million people across all age groups in the U.S., about 11.6% of the population, were living with diabetes. One of the biggest misconceptions, and a frequently misleading claim, is that adjusting your diet alone can cure or reverse type 1 diabetes. Nutrition certainly plays a key role in managing the condition and maintaining overall health, but no diet can replace the need for insulin. Without sufficient insulin, glucose accumulates dangerously in the bloodstream instead of powering your cells. This is why daily management and lifelong insulin therapy are absolutely essential for survival. So, how far are scientists from finding a cure for type 1 diabetes? Research worldwide is actively exploring several innovative approaches, which generally fall into three major categories. 1. Cell-based insulin therapies. This pioneering research aims to restore the body's own insulin production. One method involves transplanting insulin-producing islet cells from donors into patients with type 1 diabetes. Other experimental strategies include reprogramming other pancreatic cells to start producing insulin or regrowing beta cells from stem cells, essentially trying to reboot the system. 2. Beta cell protection. Another promising area focuses on safeguarding the remaining insulin-producing beta cells in people who are newly diagnosed or at high risk. For example, some studies have tested monoclonal antibody treatments that can delay the progression of the disease, effectively buying patients more time before they become fully dependent on insulin. While this approach doesn't cure diabetes, it represents a crucial step forward. 3. Advances in insulin delivery. Although not a cure, technology to improve insulin administration is rapidly evolving. Scientists are developing artificial pancreas systems that use continuous glucose monitors combined with automated insulin pumps to regulate blood sugar levels with minimal user input. Additionally, the concept of smart insulin is being explored. This is insulin engineered to activate only when glucose rises, which could transform diabetes management in the future. Genetics also play an undeniable role in type 1 diabetes risk. The absence of insulin leads to high blood sugar, which over time can harm vital organs including the heart, eyes, kidneys, and nerves. While the exact cause of the autoimmune attack remains unclear, research has confirmed that having a parent or close relative with type 1 diabetes increases your chances of developing the disease. This risk is connected both to family history and certain genetic markers. However, genetics alone aren't the whole story. Environmental and other factors contribute as well. According to the American Diabetes Association, for example, if both parents have type 1 diabetes, a child's risk can be as high as 1 in 4. To help clarify common questions about type 1 diabetes, what are the usual symptoms? People often notice extreme thirst, frequent urination, unexpected weight loss, constant hunger, tiredness, blurry vision, and sometimes a distinct fruity odor on the breath. These symptoms can escalate quickly if untreated. Can type 1 diabetes be prevented? Unfortunately, no. Since this is an autoimmune condition targeted by the body's own defenses against insulin-producing cells, no lifestyle modifications or interventions have been proven to prevent its onset. Is type 1 diabetes deadly? With modern insulin therapy and proper care, individuals living with type 1 diabetes can lead long and healthy lives. However, without insulin, dangerously high blood sugar levels can cause life-threatening complications. At what age can type 1 diabetes develop? While it commonly appears in children, teenagers, and young adults, it can actually be diagnosed at any age. Adults sometimes receive a late diagnosis, which is often mistaken for type 2 diabetes, adding complexity to proper management. And this is the part most people miss. Despite technological and medical advancements, type 1 diabetes remains incurable at present, and the daily burden of disease management continues to challenge millions worldwide. Is it fair to hope for a cure so soon, or should we accept that insulin therapy is here to stay indefinitely? What are your thoughts on the balance between managing chronic illness and the pursuit of medical breakthroughs? Share your opinions and experiences below. This is a discussion worth having.